Hello, everyone, and welcome back to the Empower podcast. We have our returning guest here, Julie, coming out of Denver, Colorado. Thanks for being here. We appreciate you. I looked at it. It's been about 500 some days since the last podcast. I'm excited. Wanted to start off here with just a thank you or an acknowledgement to a group, organization, individuals that are in your life, have been in your life, in any way, shape, or form that you'd like to acknowledge at this time.
I really want to acknowledge healthcare professionals. I mean, just every single one. The nurses, the CNAs, the doctors, the lab techs, the medical assistants, anyone that's really on the ground doing the work and taking care of the patients as healthcare just continues to change from what we know it.
Truly, and it is before our very eyes. It is changing. Wow. I've asked myself sometime on the podcast, Brett, does this guest make you feel empowered? And yes, Julie, you definitely make me feel empowered with that acknowledgement. Folks, if you haven't gone, there are 2 other episodes that have dropped as well with Empowera. Since we're back. Yeah, we're back. So go ahead and check those out. And if you're listening to this one, it's in no particular order. So have fun. See what it is you discover. Now, we're going to get to the question as to why we're here. Julie, what, in your opinion, is happening in healthcare, health and wellness, all of it?
Let's see. What do I think is happening? You know, I had a really interesting conversation today with somebody. We were talking about Happy President's Day. And I was like, is it a Happy President's Day? And they were really looking forward to the economy shifting. And I'm just really present to changes in healthcare that I'm not looking forward to. Like changes in copays to insulin. And I will say like cap pricing for certain medications. So my thoughts are really high on who's driving change to medical practice. Changes to the CDC, changes to being a part of the World Health Organization as a country. And just, I'm really present to, there's a lot of changes and a lot of unknown happening right now in the medical system from a very top leadership standpoint and how that's going to trickle down into our healthcare system. Minute changes that take place for an individual's healthcare.
What that looks like while we're up against even changes with AI and the integrations of what it is we can see as potentialities is what I'm saying. The integration, I think, for the overall patient experience. That's the what it is I'm getting from you is you're looking at the patient experience so far as to how that's being affected by the economy, by changes in price. Because these are still goods that are being exchanged, whether or not they're imported or exported, right? And there's still people that need them.
Yeah. Let me see if I can find it.
Yeah.
I mean, because when I think about cost of healthcare, the bottom line is the cost of healthcare to an individual can be life or death, can be quality of life directly. And, I think I might have brought it up on our last conversation, actually, where I think I was in the throes of working in an ER for a healthcare system, and just seeing huge amounts of just too many patients for the amount of beds we had, and what was going to happen to the patients, not just the healthcare system, if they couldn't get seen or if they can only get seen and they can only afford care if it's in an ER. But then an ER can't really take care of them because they just don't have the capacity, particularly if they're not urgent specifically. So I'm just really it's interesting that that's still on my mind 500 days later.
No, it's still present. Yeah, I get it. And the integrity of it is still something that you'd like to declare, at least to see what it looks like and to speak about it. Because there's a lot to that. There's a lot to declarations. And that's literally, that's someone's well-being. That's the quality of life, because the whole point is anywhere supposedly in life, except for a couple places I've found, and this is just on my own discoveries here, you're not supposed to be at places long. It's usually life and measure. We have beginning, middles, and ends, and then being able to make those ends justified so that you can literally have an end of whether it's a patient experience or not. But to see when it comes down to it, and I'm going to speak from personal experience because I am still talking with some recruiters. They share with me, had never talked with them before. One of their first introduction questions after I told them what it is I wanted for an assignment was, "Are you comfortable with this ratio of patients?" And for me, I'm like, is this really where you want to start? Imagine I was a new travel nurse and this is literally the first question that I'm going to get from you. Like, do I have to make my decision now? Why do you have to ask me now? There's all these other questions that come out of that, even beyond. Then it's not about what it is you're making for income, and which isn't getting cheaper and hasn't. But at the same time, too, then you're looking at integrity, declaring, yes, I am comfortable with that ratio. And then one thing after, now we have that as our company policy, that ratios now are 1-7 with this facility. And it's like, not everybody wants that. Some people I'm just going to say it, some people get mad as hell, Julie. They get mad as hell. They get mad as hell on not wanting specific things in their contract, and they know what integrity is, at least from what they've seen on their own assignments. I'm not saying everybody's in their rightful mind. Some people are working 6-7 shifts in a row. Some people are on their 21st out of 30 that we'll find out later next month, and they might even end up in that ER that you were talking about that will be understaffed. And they were literally the ones. They were the hands there. They were the boots on the ground on the floor doing that. What is that? There's a phrase from one of the DC Comics Watchmen. If the Watchmen watch us, who watches the Watchmen? And it makes you wonder, though. So, and it just goes to the integrity of the system, because those, like I said, those are the hands that are there. Those are the boots that are on the ground making that difference. And it's, in my opinion, even from what I'm reading on some of social media, if you take it with a grain of salt because it's social media, is people are fed up. And these are just general consumers that are still those people that will be in a patient bed, and hopefully they won't. Hopefully at a minimum, hopefully they live a long, healthy life, and they have everything in moderation, like I was taught. Having to be part and member within any healthcare system, whether you're a patient, a family member, or a loved one, because that is the other thing too, is being able to declare the integrity aside from being a healthcare professional. I don't know if you would like to speak to any of this, but if you've gotten to have, even in your own life, to be able to declare the for yourself as to what it was not being a nurse. I didn't know.
Yeah, I think that's why I'm feeling this a lot, is because I do have a chronic illness myself.
Yeah, and share what
prior to our last conversation. So since then, I was diagnosed with an autoimmune disease. Now, thankfully, I don't need to take a medication necessarily to treat it ongoingly. But it's something that's really near and dear to my heart, and has me really concerned for my health care in the future, because there's a lot of implications from one diagnosis to another. And I think that allows me to be pretty empathetic towards those with healthcare needs, because you don't get to choose a lot of your health. I will say, the way your body doesn't work. You don't really get to choose that, and or it doesn't work as well as we'd like it to. And to me, the cost of healthcare is it's such an important topic, in that the companies care about it, the hiring managers care about it, the employees care about it, and the consumers care about it, and it's very commercialized in a lot of ways. So, just really, it's a burden to care, like an obstacle to care, and impacts people directly. I mean, the amount of times that I've thought to myself, oh, I shouldn't, it's not just time and energy. It's like, oh, do I have the money to pay for that bill if I were to find out that I needed something? It's one of the only consumer, like, things that I purchase that I actually really struggle with knowing the cost of before I buy. Right? When I get, let's say I walk into an ER, I really don't know. They don't know. I don't know how much this is going to cost me. And isn't that insane? I would never go into a store and be like, oh, by the way, I want to buy this perfume. I'm going to go take it home, or I'm going to go use it. And then you can tell me how much you're going to charge me for it. And there's nothing I can do about it. And then we wonder why we have a lot of illness that could have been prevented.
And the other thing that gets me too, and that's a very powerful share. I really, truly appreciate you taking a stand here and sharing what it is you're sharing. It's for millions of voices, I don't doubt, that even want to share something of an equivalent of that. So what gets me about the overall, about and seeing it then for yourself, is knowing then what others are up against. And I don't know, we live life in measure, I said before, right? So beginning, middle, and completion in whatever it is a health endeavor may be, because I think they come, right? They're endeavors, usually, hopefully, from what I see, they can come intermittently, whatever it may be. People do get sick, boo-boos do happen in whatever way, I say that, but it's that ability to bring it and not have it be such a staged process. So it's not staged. It's literally being able to, like you talked about as a consumer, right? Being able to go, have point of sale, pay your tax, get your receipt, or thank you, bye. And even know that before, because the price tag's on the shelf, is that you're up against something. There's a podcast I used to watch and listen to called What the Health, and they would talk about the price transparency within healthcare and where it is. It's amazing to me, even too, billing-wise, that there's what's called retroactive and proactive billing. We have a distinction in how things are paid for. I don't have that with a Snickers bar. If you eat Snickers bars, not sponsored by Snickers, but or any of that. Like, it's literally just, it's there. You're correct. It's right before your eye. And it's almost as if, okay, so I'm walking in, my body's a Rubik's Cube. So we don't know until all the stickers of the same color are aligned. And even then, yeah, it's a staged process.
I'll tell you more of my personal experience. But within the last year, I was ordered a test that I was told by my doctor would be preventative, so should have been covered by my insurance. They reassured me. I had to have my primary care doctor order it based on, my insurance requirements. My primary care doctor ordered it. And then for a series of 12 months, I went back and forth with the company after the fact, after it was a diagnostic procedure, all preventative, came back with, normal findings, but, which was recommended by my doctor. I could have said no at any point, right?
Right.
But I was told it would be preventative. Now, I wasn't told it would be preventative from my insurance directly, so that's, maybe where I went wrong. But I went back and forth. I even got my insurance on the phone. I even got my primary care physician's office on the phone with the billing department of where I got this diagnostic test. And everyone was in agreement. It needed to be a certain code, and it needed to be ordered that way. And that doctor could not order it in their system that way. And I even got so much as accused of this by their billing department that I was committing insurance fraud by trying to change the code after the procedure was completed. Meanwhile, there's no accountability. I'm the one that is going to have to pay this. That's going to have to, literally it could go to collections under my name and have a huge impact on my life if it's not taken care of by me. The amount of man hours I put into calling these different companies, waiting on hold, verifying myself, and trying to have these conversations, it's unfortunate. I'm not diminishing the work of the radiologist. I'm not diminishing the cost of the equipment or what it runs or what it costs to run a business. But what other industry is that okay? What other industry? There's no accountability for that.
And where it's a hop, skip, and a jump for consumers to get the service, because that's what economy is. I'm finding out so far is goods and services, right? To be able to have a service provided. And wow. And you're the one who made it all line up. You're the one who's accepting the liability as they They were allegedly, right, accusing you of potential fraud, yet you were the one taking a stand to make sure it seems that there was an audit going on, I feel like, on your opinion as a consumer, to make sure they all knew that the same conversation was occurring. So we would have, even within healthcare, what's called closed loop communication. But it doesn't sound like they were maintaining the integrity of that closed loop communication. You were the one that was being put on this.
Yeah.
Wow.
So
And that's even before the alleged potential false accusation, or potentially false accusation, again, allegedly, of insurance fraud. So it's like, if you take your stand and
I've since settled it. I will say that.
Hooray! Thank you. Completion.
This week, and it was done over a year ago. And it was not free. It was not considered preventative, but I settled it, is the point I'm trying to make. And again, there's no recourse. There's nowhere to give a bad review or stop, frequenting their and increasing their marketing.
Yeah, or staying within network so you're not getting charged other fees too.
Mm-hmm. Mm-hmm. Yep. And it's just I don't know that I even have the solution. It's the way the system is set up currently. And for me, in this case, I was able to settle it. But let's say it was something that had gone on for a while. Maybe it was a treatment plan for a patient. Maybe it was, there's so many. It's
right.
like a full-time job.
Yeah.
To try to make sure these things are corrected. And I have a background in healthcare, and I was still like, I don't know coding rules. I don't know coding ideas. I just was told to do this, and I was told this would be the result, and then it wasn't. No accountability.
And I'm glad you have the words for it, because the other people, they'd probably hang up the phone while they were on hold too. Do it. Please, try it on. It worked for Julie. At least she got her own area of getting complete in whatever it was. Whether it was even the discovery of the way that the system is, and that she can share that. That is way more valuable, I think, than any price tag you could be. Thank you.
Yeah, you're welcome. I'd love to see where health insurance didn't occur like a monopoly, where you didn't really have a say over your care, but you actually, where your providers can actually utilize their degrees and their education and their expertise. And if you're in agreement, you can get taken care of. Ultimately, that's what I care about, is that people are taken care of. And the way our system currently is some people get taken care of, some people do not. Some people are taken care of in certain ways, some people are not. And there's not a ton of reliability for everyone getting taken care of. And that is what I care about.
Yep. For me, and if I can relate, it's what sleep at night. Sometimes at night before I go to bed, I wonder, I'm like, I know what the integrity of healthcare is like out there. And I really feel for a lot of the healthcare professionals that are still at the bedside. I really do. And I'm really trying for my own self to invent possibilities beyond the bedside and still be a nurse. So that's just what I've occurred. And it doesn't mean in any way, shape, or form I'm trying to invalidate their work or their workability or any of that. It's just that it takes a specific nurse. I think I've heard that about all specialties, even from nurses I've discharged when I was a transporter. I remember I asked her, I was like, why did you stay in nursing? It was one patient I did discharge. I'll never forget her. And she said, because you can jump around. There are specialties. So if there's one area where you don't belong, because each one does take a specific nurse. And I'd be curious if it's throughout phases of life too, where that specific nurse is really in specific specialties. And that's all theory, folks, do your own research. But I really think that, and what occurs too. I had a doctor that I worked underneath when I was in Colorado, and he was a Berman victim. So he had his own history within the healthcare system. And some of the times, I'm not always saying I want somebody that's had to go through the ringer, but it really has a standout for me to see, even then, the distinction of a healthcare professional being both the patient at one time and then making that distinction and taking that stand as the professional. That's just...
And that's the hard part too, whenever I tell people about some of these issues I've had as a nurse. financially or receiving care or feeling listened to and all of that. And they're like, oh, but you're a nurse, you work in healthcare. Yeah, I can't afford my own hospital. Can't afford to even, it's kind of like a retail worker not being able to buy their own products at their store.
Yep.
But to give a little bit of background, there's some great documentaries out there, some of which I've seen, just about pharmaceuticals specifically, because that's the topic I kind of brought up at the beginning was, there are companies that have literally been proven to increase the cost of a product without increasing fees of their product, if that makes sense. Like, it costs them no more to make the medication or the drug, which is often life-saving or life-altering, and it's the only medication of its kind, or maybe it's the only one that works for a patient. And I'm not talking about like, oh, they liked a little bit more money or profit for their shareholders, where they've really increased the cost by 2,000% without increasing any of their research and development budget, where they're not actually increasing any overhead for manufacturing the medication. They're just price gouging, and it's costing people their lives. And that's something where our political system actually matters. And it's gotten me more interested in that, because I'm not a very political person. I have never truly been that interested in politics. But when it comes to the affordability and the difference between life and death around a patient, I care a lot about that. Especially, let's just say, if it was your loved one.
Yep. Friend, family member, any part of the social structure, whether, yeah. It could be anyone. You're correct. Anyone, anywhere at this time, from what we know. It's like a minefield almost. The phrase if I can offer this, the phrase I've gotten from when it comes to healthcare for me so far, not the toughest nut to crack so far that I've found. And for me, it doesn't make sense. I think that's what you were kind of declaring. The integrity is there, but for me too, the overall deliverability beyond any good or service is its own. It's a wild card, and it's showing, and we see it, and we want to make a difference. And I say we because at least in the United States, there is the phrase "we the people," and I think there are areas that we all share. And I appreciate you taking your stand to share your thoughts on politics too. I'm in no way, shape, or form trying to force anybody to do that in here, but it truly makes a difference, because it's a root, right? It's the root it's one of the areas of the root, I think, that we can truly make a difference. It's said it on one of the other podcasts too, is anybody that thinks that a small group of people can't make a difference, well, it's merely the only thing that has. So I think it could be conversations even such as what we're having here, and being able to spread that across the airwaves so that others can know that they're not alone, that there's other people that have had this occur in some way, shape, or form, and that they can make a difference if they would like. So, wow.
And I'll just emphasize to make sure to do your own research.
Of course.
I don't know when our listeners will be listening to this, and so much has been changing so quickly, especially politically, with certain executive orders and things like that. I just tried to fact check myself. And apparently the cap on, I want to correct myself.
Yeah, I know what you got.
The cap on insulin drugs was not altered. But there was an executive order that was, let's see, hold on, I want to make sure I'm reading this. But that certain prior executive orders having to do with drug costs and things like that might have then been revoked. And replaced, which then those new, executive orders or laws could be directly impacting patient care. So yeah, that, make sure to fact check in terms of what is available to you now.
Wow. And it's amazing too for me. You mentioned insulin, so I lean in with insulin because I believe it's derived. I'm getting geeky here, folks. I believe it's derived from either bovine or from swine. So either pig or cow. But what makes me wonder then is if the costs of drugs are that way, then should we look more, and this is theory, right? Should we look more to the agricultural area then too? Because it makes me wonder too. I'm not too far from Barberton, Ohio, and I just saw that there's an actual hog. It's like it was a farm. The gentleman who founded the town, O.C. Barber, he was known for his hogs. That's just the way that it was known. And my theory, this is theory, of course, is the old hospital is not too far from where the pigs were. This is theory, okay? And I wonder if he was one of the first people to help with the formulation of insulin. This is theory again, big amount of theory. That's not the only area of evidence, but because if you look up in research when he was taxed for it, I was curious on it. It was for they were experimental pigs, and they don't say why. So the only way I could think would be that because even the use of this is another geeky part. When the first trial and use of adenosine was actually done at University Hospital in Cleveland. So that's why I'm saying it could be out of Ohio. I'm not saying that's the history of things. Again, like you even said, to do your own research, folks. Decisions here. So, and I appreciate it. I didn't know if you would like to bring us back with your empowering quote, or if there's anything else you'd like to mention before we reach the quote, please do.
I think that's it for today. Thank you for having me. It was great to chat briefly, and I hope it gave some people some things to think about and plan for their own care and budgeting.
Yeah.
So I would say I had 3 quotes. I finally decided on
awesome.
one.
Let's read them all.
This one's a long one. So the thing I would say is when you grow up, you tend to get told that the world is the way it is and your life is just to live your life inside the world. Try not to bash into the walls too much. Try to have a nice family, have fun, save a little money. But that's a very limited life. Life can be much broader once you discover one simple fact, and that is everything around you that you call life was made up by people that were no smarter than you. And you can change it. You can influence it. You can build your own thing people can use. The minute that you understand that you can poke life and actually something will, if you push in, something will pop out the other side, that you can change it, you can mold it. That's maybe the most important thing, is to shake off this erroneous notion that life is there and you're just going to live in it, versus embrace it, change it, improve it, make your mark upon it. I think that's very important. And however you learn that, once you learn it, you'll want to change life and make it better, because it's kind of messed up in a lot of ways. Once you learn that, you'll never be the same again. That's a quote by Steve Jobs.
Whoa. Hang on, folks. Is that 2 more? You said you had 3 quotes. Was that the first?
Yeah, I'm just going to leave you with that one.
Yeah. All right. I dig it. I love it. Folks, this has been a comeback and return episode with Julie. Thank you, Julie, for being here. Much love. And folks, look forward to you seeing again. Bye for now.